Kidney 1 is a deeply calming point, and it can be used to get rid of excess energy. So it's good for headaches, and this is a good point to ease foot, leg, and back pain. A gentle massage here before bed will also be very useful. So kidney 1 is located in between the second and third toes, so you travel up in between, past the ball of the foot, about 1/3 of the way up the foot, and right around here is where the point will be. You can hold this point for 1 to 3 minutes until the client feels some relief. This is a really relaxing point for anyone who's a runner or who is on their feet a lot. This is going to be a key point that you can do on yourself or that you can do to clients and work into your foot massages. The 3 whites points is a good one for heel pain, ankle pain, plantar fasciitis, and also bone spurs. It's referred to as the 3 whites because it's located around where the red of the foot will disappear into white. So with this one, you're on the sides of the heels like this. You can do this on yourself, or you can also do it during your foot massages. I like to place 2 thumbs down on either side of the heel, and then I'll do a reinforced fingertip on top like this, and then I'll press down for 1 to 3 minutes, depending what my fingers can do that day. Contact all 3 points, and then wait for a relaxation. With this one, you can use a firmer pressure, and I find most people are able to take that. Hold this point, and then once it feels like there's some relaxation around the Achilles tendon and the ankle or down the foot, you can slowly release this point, and that is the 3 whites. After you've done the 3 whites, don't forget about the center point in the heel. This is used a lot in foot reflexology, and it's a really, really awesome point for ankle or foot pain. So press down in that area. If you find it's too hard on your thumbs, take 1 fingertip, reinforce, and then press in. And here you could use a firmer pressure as well. You could even use the point of your elbow for this area and it would be fine. So you'd want to massage in a clockwise motion for relaxation. After you've done that for about 1 minute, stop. Use a static pressure for about 30 seconds, and then slowly release your pressure from the area. The technique that I like to finish the foot off with is a double point technique. So you do this on both feet. So in between the first and second metatarsal, you're going to find liver 3. In between the 4th and 5th toe, you're going to follow that up in between, just slightly higher, and that's gallbladder 41. With these 2 points, you can massage back and forth in between those metatarsals. You'll feel in between the bones. You'll be in this kind of webbing area. That's what it's going to feel like. You're going to do both of these for about 2 minutes and do it on both feet. This is incredibly relieving for neck pain and also for foot pain. One of the great things about acupressure is that it's so awesome to bring into your face and scalp massage, whether that be your everyday massage or if you want to do it as a special add-on service. So you want to start the massage by spreading the tissue out. So you're going in the shoulders, you're going up either side of the spine, and then spreading out away from the spine around the neck. You're going to be doing this on both sides with both hands. And you want to do this several times to stretch out the tissue in the back of the neck. Start your facial massage by massaging from the chin away from the midline into the jaw. You can do this at the lower portion, just a little more gentle. And then you can move up into the chin, move to the side, and then spread up into the TMJ along the jawline, and just continue that forth. You can go in the lips, just above, around the cheekbones, and just keep spreading away from the midline, just relaxing all that tissue in the lower face. Moving on to the upper face, you can kind of work around the cheeks with 2 fingertips, and then around the forehead, around the nose, and then around the eyes. This is going to be really relaxing for anyone who has eye strain, who's been at a computer for a long time, and who's just feeling like they're very sluggish and worn down. After you've done that about 5 times, you can then move on to the forehead. So you can pinch the eyebrows just gently in different portions of the eyebrows. So you're just moving along the eyebrows with this nice pinching technique. It's very grounding and relaxing. Then with a reinforced fingertip, gently work around the eyebrows, pulling up from the upper portion of the nose around the eyebrows. And then you can pull up above the eyebrows in the forehead, in the frontalis muscle. This is a muscle that can be very affected by any office workers working at a computer. Stress, you'll scrunch these muscles up. So it's really nice to stretch them out, and you can be quite gentle in this area. So you just want to work up the forehead about 5 to 10 times before you apply the acupressure points. So after you've worked on the face and you've covered the lower and upper portion, you're going to want to then work on the acu points. We're going to start with gallbladder 14, which is in midline with the eyebrow, just above, about 1 finger width above, right around here. With this one, you can place a fingertip down, or you can place thumbs down, and you want to be quite gentle here, and you just want to hold this point for about 30 seconds to 1 minute. And you're just being a very calming, grounding presence as you perform these techniques. After we've gone from gallbladder 14 and this area is feeling nice and relaxed, you can then move to yin tang 1 in between the eyebrows. Here you can use a reinforced fingertip, create a slight traction upward, and then do a nice circular massage in this area for 1 minute. This is known as the third eye. This is a really grounding point, and as we've discussed in this course, this point is so useful for so many different things. After you've done that for about a minute, then you can slowly ease off and move to urinary bladder 2 on the inner edges of the eyebrows. And for this one, I just like to hold here with a slight upward pressure, but quite gently. And you could hold this for about a minute and then move on to the next point. From urinary bladder 2, you're going to move to large intestine 20, which is just on either side of the nostril. And you could place 2 fingertips down here, and then you could slowly pull away to open up the nostril. With this one, you can do some nice circular motions in the area. And this is a very relaxing grounding point. And it's good for anyone with sinus issues or congestion. From there, you're going to move out slightly laterally. So you're going to travel along the cheeks to small intestine 18. You can use 1 fingertip, but here I like to use a bit of a broad contact. So I'll use 2 or 3 fingertips. And then it's kind of in the big jaw muscle here. It's along that point. So do some nice circular motions in this area, which is nice and relaxing, or you can go up and down as well. And you do that for about a minute. And then you move on to governor vessel 26, which is right below in the upper lip. So you can take your thumb and then press down. So I'm moving in a slight downward movement from this area. And this one is very gentle. And this point is said to be good for any emotional issues. So you can press this point for about 30 seconds and then slowly relax your hand, work up the jawline and then back up through the jawline. And we're going to move on to the points on the top of the head. About 6 finger widths away from the forehead on the top of the head, you're going to have governor vessel 19. It's going to be on the hairline. With the points at the top of the head, you can just hold statically, or you can do a clockwise motion. I would say just practice this on yourself or other people and get their feedback and see what they like. So you can hold this point for about a minute, and then you're going to move up to governor vessel 20, just up slightly, right on the hairline. And you're going to hold that point for a minute. And you're going to do some nice circular motions or static pressure. Move up slightly to governor vessel 21. And finally, you're going to move up one more level to governor vessel 22, which is going to be close to the forehead. Hold that for 1 minute and then move on to the points for the urinary bladder. For urinary bladder 6, you're going to be right here, and you can do some nice circular motions, or you could just hold statically. Then you're going to move back about 2 to 3 finger widths back, and you're going to hold there. And then finally, urinary bladder 8, you're going to go another 2.5 finger widths back and press in that area. Moving on from the top of the head, you can then transition that into working on the temples. This is going to be good for jaw pain, working in the temporalis muscle. Just doing a nice little massage here and then behind the ears. And the first point that you'd want to contact is right behind both of the ears, and that's going to be triple heater 17. So right behind the earlobes, you're going to find a point right there. Triple heater 17. You can then massage on the earlobes, make sure they have their jewelry off, massage around. And then in the ears, there's 3 points that are quite useful. So at the top here, you're going to find triple heater 21. So it's going to be right on the top edge right here. So you can press that point on both sides and just do some nice circular pressure in this area, and quite gentle. All of these points along the ear are going to be good for tinnitus and jaw pain. Next up, you're going to move down just slightly right around here in the middle, right there, kind of in the indentation where you would feel the jaw. So this point is small intestine 19. And this is a good point for TMJ issues and jaw pain. And finally, you're going to finish just in the lower edge right here. And you're just going to press in that area. This point is gallbladder 2. This is a good point for toothaches, and it's in the lower portion of the outer ear. After you've worked on that point, each point for 1 minute, you can then work around the jawline, and we're going to finish with getting to the points in the back of the head. To finish on the back of the neck, you can contact point 10 of the governor vessel meridian, and that's going to be right in the middle of the base of the skull. You can use 2 fingertips and press in on that point. Here I like to do just a static hold. Next up, you're going to move to urinary bladder 10, which is in the suboccipital muscles. So you're going to take 2 to 3 fingertips in the suboccipital muscles right around here. And you're just going to do a nice circular massage. And this one you could do for about 1 to 3 minutes. These muscles can be a little bit tense. They can be a little bit sensitive. So just make sure that your pressure is kind of a medium, steady, rhythmical pressure in this area. Moving on from urinary bladder 10, you're then going to go into gallbladder 20, which is a little bit more lateral to the suboccipitals. And you're going to press in that point, do some nice circular massaging. And you're going to do that for 1 minute. Then you're going to move across to the most lateral point, which is going to be gallbladder 12. And this one is once again on the base of the skull, just below. And for this point, I actually like to do an up and down pressure and massage and a nice steady pressure. And I'll do this technique for about a minute. So in the base of the skull here, what I was talking about is just on the base right here, you're going to find governor vessel 16. You're going to move slightly laterally on the base of the skull and just slightly down to urinary bladder 10. Then you're going to move across, and right around here, you're going to find gallbladder 20. And then you're just going to move slightly laterally, and right here was where I found gallbladder 12, which is the most lateral point on this line in the base of the skull. Okay guys, so I'm going to show you a little movement sequence. This can be for you. It's something I like to do in the morning, and it really brings some joy to my system, my body. It's located below the pinky finger, right